Hey guys, welcome back to Medical Coding with Blue. Today's episode is about why medical terminology and anatomy are so important for medical coders. If you are brand new to my channel, welcome. I am Blue, I'm a medical coder. Today's episode was inspired by a viewer letter. I got an email the other day from a viewer who was asking about this, and I want to read it because I want you guys to understand the importance of understanding medical terminology and anatomy, and why both of these together are like a marriage. It is cohesive. You can't have one without the other. So let us begin. All right. So the email reads, how much actual anatomy and physiology and parapsychology questions are actually on the AHIMA exam? I am wondering if I pass these classes with a 70, will that be good enough, or do I really need to remember every single thing in these classes? I'm halfway through A&P and I'm only retaining maybe a third of it. I'm taking medical terminology next, which I'm actually interested in, so I'm excited about that class and plan to really plug into it. Does the exam go back and cover each section, or is it a collaboration of all of the classes that grows to focus on the complete coding process? Also, are the exams open book? Here's the thing, guys. I think what they meant was pathophysiology, all right? Pathophysiology, physiology, medical terminology, and anatomy. These are all key components to the foundation of learning medical coding. And if they were asking, or is it a collaboration of all the classes that grows? I think they meant the culmination of all the classes. Here's the thing. You cannot have medical terminology without anatomy. That is where the words are coming from, okay? And so it's covering anatomy in there. The thing that it worries me about this email, about this person's email, is that they're telling me in this email that they want to put the bare minimum effort into learning anatomy, physiology, and pathophysiology, because I refuse to believe that they are actually trying to say parapsychology. I don't want people to think that this is okay. You cannot put bare minimum effort. Oh, I want to pass with just a 70, and will this be okay? You know, AHIMA, or the American Health Information Management Association, is among the two major medical coding associations. But AHIMA is the oldest and has been around the longest and is most steeped in history. These exams, these are not a game. These are not a joke. This is not something that you can just kind of slide through. These exams are known to be the toughest in the industry. That's the first part. Whether you're taking the CCA or the CCS or the CCSP, these are known to be very tough exams, okay? That's the first thing out of the gate. The second thing is, if this person is saying that their medical terminology is next, and they're really going to plug into that because that's what they're interested in. It is not about what you are interested in. It is about the whole thing coming together. You cannot have one thing without the other thing. You cannot have anatomy without knowing your medical terminology. That does not make sense. You can't have one without the other, guys. You have to have them both. And if you are not excited about it, if you feel like you're only retaining a third of it, it's because you're not putting in the effort. I can tell by this email, this person is not putting in the effort. They want to get to what they want to get to. Well, again, you're setting yourself up to fail if you're not putting your whole effort into it. If you put more effort into it, then you would probably get a different result. You'd probably get a better result, okay? Because it's all a part of knowing your medical terminology and your anatomy and your pathophysiology. If they would know that, they would not have used parapsychology, okay? So the thing is, guys, you have to take every single part of this seriously. Medical terminology and anatomy, they are your foundation. When you're reading this documentation, it is going to be like reading a different language. People have said this about medical coding. It is like a different language. It is true. It is like a different language. We have to know what doctors know while never having gone to medical school. I say this a lot, and I'm going to keep saying it because we have to read what they're saying. If we don't understand some part of this, some part of their documentation, then it's a potential that we get the wrong code. So that's why understanding the body, the anatomy process, the pathophysiology process, the physiology process is all key, and it all goes together. You cannot have one without the other. So don't even try to put a bare minimum effort. And if you're only retaining a third of it, you're only in the beginning part of your program, because usually that's what they teach first, okay? Although I have heard some weird steps around and how it's different. But typically you are learning your anatomy and medical terminology first, right? And when you're learning this part first, that is what is going to help you learn everything else. Because how are you supposed to understand the coding part if you don't understand the anatomy, if you don't understand the medical terminology? And all of her questions or his questions could be answered by going directly to the AHIMA website and referring to their whatever certification they're going to sit for, and it has all the domains that's covered, all the topics that are covered. They're right there. So that could have answered that question immediately. The other thing is, are these exams open book? Now, I don't know why he or she does not know this. When you go into a medical billing and coding program, they're telling you, okay, hopefully they're telling you that you need your ICD-10-CM, your CPT, HCPCS, and if you're learning the inpatient side, your ICD-10-PCS. Hopefully they're saying all of these things, and that you have to use these books in order to sit for the exam. Even when you're looking up the exam, it's telling you that you need these books. People don't get familiar with their books, and that's another problem too. So you really have to understand, okay, this is the whole package. This is what you're going to be doing. This is what you're going to be using. Because they don't expect you to memorize these codes. These codes change every year. That's why these tests are open book. You will have your books with you. You do need them in order to code. This is why when I'm giving you guys my study tips, I tell y'all to go through your books. You don't have to read the entire book, but you do need to go through and flip every single page so that your brain will know where things are in the book. You may not be able to recall a particular thing right away, but you will know where in the book to find it. You will know about the appendixes and what they cover. There's different publishers out there. This is not an ad, but of course everybody knows, if you've been with my channel for a while, that I like Optum 360 coding books. Of course, when it comes to the CPT manual, I only go with the AMA, the American Medical Association. This is a CPT professional edition. Now, yes, this is a 2021 edition. I haven't gotten my 2022s yet, but that is the only publisher I will ever use, okay? Yes, Optum has theirs, but you cannot test with their procedure manual. You cannot test with those. So if you're going to be testing, whether you're going with the American Health Information Management Association or the American Academy of Professional Coders, you will need the AMA professional edition of the CPT manual. So that is just something you guys should know. Again, when it comes to putting in the effort, you need to put in 100% effort into every single subject. There's going to be things that you are going to learn in medical coding school that you aren't going to like, that is not going to be your favorite, but that is not an excuse for you not to put 100% effort in. If you are only wanting to put effort just to barely pass because you don't like it, there's a good chance you're setting yourself up to fail. You don't want to do that, folks. You want to be able to get into this and be successful because, again, these exams are tough. These exams are going to be your key to a brand new future. And in order to be able to pass these, you have to take it all very seriously. Now, why somebody would want to put just a little bit of effort into learning anatomy and anatomy and pathophysiology and things like that, and not that same, and they want to put more effort into learning medical terminology. I don't understand that thinking. You have to be as excited for every single subject, whether you like it or not, because the joy will come with time. But if you are going to resist certain things, that is going to be a block. It's going to be a block for you to learn. It's going to be a block for you to even get started in the field. Okay? You will be tested. I'm not even talking about the certification exams. I'm talking about when you get out in the real world and the employers start to give you the assessment tests for the position, because all medical coding positions will require an assessment test. So even when you pass your certification exam, that's not the last test you'll be taking, okay? You will be taking these assessment tests with your employer, potential employer, and they cover a wide range of things. One of the things being anatomy and medical terminology and pathophysiology and physiology. They're going to be covering all of those things. Now, I know it's a lot of information when you're learning anatomy and all this, but that's why it's a process. That's why it's not just about passing that subject. It is about coming back to it as you are going through your course. Because trust me, there's going to be things when you start learning the diagnosis book and the procedure book that you're not going to understand. And you have to revert back to your teaching about anatomy or medical terminology. So it is a constant learning process. Just because you feel like you're not retaining it right now does not mean that you need to give up on it. Medical coding is a commitment, and learning it is a commitment. It is something that you have to be in it. You have to be in it to win it, right? And learning it is one of those things that is really going to start showing where you are, like mentally trying to get into this. If you are wanting something, meaning that if you're wanting something that's going to be very easy to do, this is not the field for that, okay? This is this kind of field, this kind of work in medical coding is about being able to take the updates when there's updates, and usually there's updates with the coding guidelines every single year. There's new codes that are put out every single year. There's some codes that are deleted every single year. So there is different things that come up. And as time goes on, you know, the technology advances as far as like with procedures. There's new procedures that come out, and there's procedures that they don't do anymore. So that's antiquated and they don't code for that anymore. So it is very important to not just be able to stay up on your medical terminology and your anatomy, but actually trying to keep up with what is happening. But that will take place when you get into the field and you start getting settled into your clinic and you're starting to get more specialized in that particular specialty. Then you'll have the time to sit there and really think about all those things. But you will always learn. When it comes to medical coding, it's not going to stop the second you pass your certification exam. It's not going to stop the second that you have your employer assessment test. It is going to be a continual thing, because in order for us to be able to maintain our certifications, we have to have continuing education units. In the name, it is telling you it is continuing education. And there's a lot of different topics out there about continuing education, but it's something that we always have to do. So get used to the studying now, or maybe think about pursuing another field. Because when it comes to medical coding, I only say things that I would say to someone like me who wants to be really successful at this. And when I got into this, I had no idea what I was up against. I had no idea what it was. All I knew was that it involved reading. That's it. I didn't know about the depths that I was going to have to learn all of this stuff, right? until I got into it. And I went into it with both feet. I mean, right in, because this was not just about getting into a new career, but at the time it was about starting my life over. I got into medical coding on the heels of a divorce. And I was going through a lot of things personally at the time. And so because of that, you know, I was in my late 20s, right? And I was getting into this new field. I had been out of school for many years, but I knew I had to do something in order to get my life going again. So that was what pushed me through that time. And this is something that people get into it at all ages and stages of life, right? And so sometimes when people tell me, well, Blue, I've been out of school for so many years, I just don't think that I can do this, or that's not my favorite, or okay, well, then there's time to still look for something else, right? But if this is something that you really want to pursue, you're going to face those things head on, right? You're going to face all of those challenges head on. I had been in a situation a few years into my career where I had to switch supervisors because the supervisor that I had, you know, it was a personality conflict. And the supervisor that I had before had put me, what was helping my new supervisor to put me in a new clinic, right? They were trying to get me some assignment that was new. And one of the things that I had never done was same-day surgeries. I hadn't really done a lot of same-day surgeries up until that point. And so this supervisor that I was coming from thought this would be the best opportunity for me. Okay, well, I learned something. I faced the unknown head on, because she knew that I didn't have any experience and thought that I was going to flounder, and I didn't, because I said, okay, well, I don't know this, but there's always Google. There's always all of these other alternatives to learning, and I am going to learn this. So that's what I did. And it didn't scare me after that. Once I learned how to face my fear and face the things that I was unsure of, right? Or the things that I did not know or did not have experience in, it became less and less scary. So if anatomy and pathophysiology is very intimidating to you, it's intimidating to a lot of people. It's even intimidating to doctors when they first get into it, right? They have to learn all of these things too. So it does get intimidating for anybody, but you have to be willing to face these fears head on, and you have to be willing to go at every single subject with a complete and full heart and be really engaged with it. Because if you're only going to put your feet halfway in it, you may as well not do it at all. Because again, you're not setting yourself up for success. I say things very bluntly, and I probably upset some people, but I say these things because I want y'all to be successful. I want y'all to give it 100%. I don't want to see people saying, well, if I only do 70, can I still pass? To me, if I'm giving advice, that's not acceptable. I would not want a medical coder who is only wanting to put in 70% of their effort. I would not, because think about what kind of results that coder can put into doing their clinic. Well, I don't like this one, so I'm not going to do it. Well, I'm not really comfortable with this one, but I really like this other subject here, so I'm going to really focus on that. You've got to be okay with everything. It may not be something that you like, but you still have to be consistent with the effort that you put in. Okay? There's things that I'm not really particularly comfortable with in coding, but I still do them, and I'm very good at them. There's topics I don't like to code for, but I still code for them, and I still do a really good job with them. I've actually had to train for those topics for other coders because they didn't get it. So there's those types of things. But I want you guys to be consistent with the effort that you're putting in, guys. Please put in that effort, because this is why a lot of employers hesitate to hire brand new people, because they want to pick and choose. These new coders want to pick and choose what they want to do. Guys, you got to be ready for everything, whether it makes you feel uncomfortable or not. Get comfortable with the uncomfortable. I have said that many moons ago. And it's true. You got to get comfortable with the uncomfortable. If you don't feel like you're strong in anatomy, that's where you really got to start focusing. Because guess what? There are videos out there that I have recommended so many times on the community tab. If you have been subscribed to my channel, you get those notifications, right? If you hit that notification bell. So if you're not yet subscribed yet, hit that subscribe button, because like I said, I'm here to kind of help you guys, guide you through those murky waters of I have no dog in the fight. If you're going to get into this or if you're not, it's entirely up to you. I'm just here to help you, because I have nothing to sell you. I have nothing for you to, I have no vested interest other than the fact that I hope that the next generation of medical coders puts in a lot of really good effort so that these employers will start to take chances on brand new people, because they've put in the effort. They want to do this. They want to put 100% effort in, not just murky effort. They want to put whole energy into this and learning. At least that's just my advice, guys. Both of them are important. Anatomy, medical terminology, pathophysiology, and physiology, all of that is all important, okay? So don't take anything lightly. It's all important. And the better off you are with studying, watching these videos, listening to these videos, so that way you can understand. Dr. Antonio Webb, who is a neurospine surgeon from San Antonio, or in San Antonio, that's where he has his practice. He has a new channel out all about the spine. I'm going to be leaving the link to that channel in the description box below. Subscribe to his channel. Listen to what he says about the spine. If you're ever going to be in a situation where you have to code for the spine, at least you'll know and understand, what does this mean? What does cervical spondylosis mean? What does all of that mean? So again, it is a very valuable resource, guys. There's tons of really good channels from reputable people out there on YouTube to be learning about medical terminology and anatomy. All right, guys. So that is something that I will share with you guys today. Please check out the description box below so that way you can get all of that information. Subscribe to these channels. I do list my 3 favorite doctors, Dr. John Lynn, Dr. Antonio Webb, and Dr. ZUBIN DAMANIA. All very good doctors. And they're all special in their own ways, because they have something to offer the YouTube audiences, right? And not only that, it's so important for medical coders to start listening to these doctors, so that way you can be prepared when you get into your own clinic and you get around your own doctors. So that way you have something, some frame of reference to go by. At least this is my advice anyway. So I'm going to wrap this one up. Thank you guys so much for joining me. Again, it's a little bit of tough love, but it's because I want you guys to be successful. And sometimes this is what you got to hear. Like, subscribe, share, and I will see y'all again tomorrow. Bye.